Welcome, everyone, to our sixth presentation in the Osher Lifelong Learning Institute 2026 at the U Lecture Series. I'm Laura Peterson, an OLLI volunteer. The Osher Lifelong Learning Institute at the University of Minnesota is a vibrant learning community for people aged 50 plus. Part of the College of Continuing and Professional Studies, OLLI belongs to a national network of Osher Lifelong Learning Institutes supported by the Bernard Osher Foundation. I would like to acknowledge and say thank you to our sponsor, the University of Minnesota Alumni Association. We also acknowledge that the University of Minnesota Twin Cities is built within the traditional homelands of the Dakota people. It is important to acknowledge the peoples on whose land we live, learn, and work as we seek to improve and strengthen our relations with our tribal nations. Today's presentation is about the internationally recognized Institute on Community Integration. Our presenter is Dr. Amy Hewitt. Dr. Hewitt has an extensive background and work history in the field of intellectual and developmental disabilities and has worked in various positions over the past 30 plus years to improve community inclusion and quality of life for children and adults with disabilities and their families. At the University of Minnesota, she is the director of the Institute on Community Integration. Dr. Hewitt earned a bachelor's in political science and psychology at Indiana University, a master's degree in social work at Indiana University, and a PhD in social work at the University of Minnesota. I will turn this over to you, Dr. Hewitt.
Great, thank you so much. And I'm thrilled to be here with you. Give me 1 second to get my presentation slides up and running. As the introduction said, I work at the University of Minnesota and I direct an institute, and I'll talk about that in a minute. But I think it's important to introduce myself as a person and what brings me to this work. And really, this work is an intersection of my personal life and my lifelong professional life in supporting children, youth, and adults with intellectual disabilities. This is my family, and I started working in the field as a direct support professional. Those are the individuals that support people with disabilities in their homes, in their family home, in the group home, wherever they might live, but also in the community where they work, where they have fun, where they learn, and where they build a life like everybody else in our communities do as we grow and age. So that was my first job. When I got done with graduate school, the first time I started running group homes in the state of Indiana, liberating people with intellectual disabilities from institutions, and met my husband doing that work. And he happened to have a brother, Nathan, who lives with autism and intellectual disability, as well as he is a recovering alcoholic. Nathan on this photo, if you look at your screen, is the man to the right, and then my 2 sons, myself, and my husband. Nathan just turned 52 this year. That seems unbelievable to me because I've known Nathan since he was 17, and he has lived with my husband and I in our home for about 30 years, a little over 30 years. He has an apartment attached to our home, and we're charged with providing most of his services and helping him to find staff that help him have a life in the community. Most recently, Nathan became a hero in our lives because we had a house fire on February 27th. Nathan was home in his apartment alone. My husband and I were gone, and he heard our smoke alarms going off, called the fire department, got our dogs outside, and we have a home, and our dogs are alive and well. Those are the two of them in that photo, because Nathan learned safety, and it's one of his big focuses. And to be honest, the fire extinguisher that he tried to use to put the fire out is one he insisted I buy because our fire extinguishers were out of date, according to him. And I sort of pushed back on him and said I didn't want to. I acquiesced, I bought them, and he was right, I was wrong. So my career is really foundational to me, but built on my personal life. The Institute on Community Integration celebrated our 40th year this past fall. We do birth to death services and supports for people, and also our focus, my slides are going amok on me. Um, our focus and our core activities are really research, education, training, outreach, consultation, and dissemination. We are what's known as our state's University Center on Excellence in Developmental Disabilities. One or more of these centers exist in every single state in the United States, as well as in the United States territories. And our funding comes from the federal government through an act called the Developmental Disabilities Assistance and Bill of Rights Act. And I share all that with you because for the past couple of years, centers like ours have been on the elimination list in the president's initial budget that comes out. It just came out. We were slated for elimination again in that bill. And we'll fight hard with our allies in the community to make sure that these programs continue to exist, because we know our work is important and it has an impact on making sure that professionals have the right training across a wide variety of academic disciplines. We train graduate students in over 16 academic disciplines at the University of Minnesota, and they come from every single college on our campus. Our focus is really on trying to ensure that children are identified very young and early enough that the services and supports they get can have a lifelong impact on their outcomes. The earlier we can identify a child, whether that's with autism or intellectual disability or a genetic disorder that they're born with, the sooner we can get them to services, the better their life outcomes are going to be in literally every area: academic performance, employment, their ability to earn a living wage and take care of themselves in the community. So big part of our work is about trying to train and educate not only students, but professionals and families in the community. We do a lot of work around policy and policy advising. We are not lobbyists. We do not engage in any of that work, but we do educate our elected officials on issues related to people with disabilities. We currently have projects that literally focus from birth to helping people plan their own end of life and to understand options for retirement, those kinds of things. I want to start out, I'm making an assumption we have a pretty mixed audience on this webinar today, and so I just want to give some foundational information. When I think about disability, we all have different words that are used to describe it. It seems like even those of us that work in the field, we're constantly, somebody's coming up with a new word. And really, I think disability is a good word. It is really a core word that if you look if you pull it apart and look at what it means, the dis component of it really is focused on a part of or asunder or different direction. And the ability piece is a state or condition of being able or the capacity to do. And disability means just simply that people learn differently, they do things differently, and they have different lives. And that it really is a natural part of who people are, how they were born, how they developed. Developmental disability is a category of disabilities within this broader disability community. And it really, what differentiates it is that a developmental disability usually happens or it always happens in a early developmental stage of life, different ways that it's defined in policy at the federal level and across states, but the typical cutoff of that is 18 to 22 years of age. Lots of different disabilities fall under this broad category of developmental disabilities. So it could be things like cerebral palsy, Down syndrome, Tourette syndrome, many, many different specific types, but developmental disability is just a group that sort of brings together people who have lifelong disabilities and need support in different areas of their life to have a good life. And to give you kind of a historical perspective, there are lots of different lenses and views on uh, disability that have shaped where we are today, what we know today, and what we're really trying to do today related to people. Whoops, there's supposed to be a video playing here. There we go. And as a part of our 40-year anniversary, we really tried to reflect on those 40 years and identify where our institute, where we've been, where we need to go, but also the impact that our institute has had at key points along that historical journey. And as a result of that, I think a lot about the progress that's been made in, if you're a historian, 40 years is a really short amount of time. And so a lot of progress has been made, but that progress also is threatened every single day. We've benefited from remarkable leaders who've helped shape services and supports for people with intellectual and developmental disabilities, and we've come a long, long, long way. So there's a whole lot to celebrate. We're going to talk a little bit about that this afternoon. And I'm assuming some of you on this webinar have been a part of that journey or known somebody who's been a part of that journey. And so you may have been involved in creating some of this change or making people aware of the need for some of that change that happened over that 40 years. But the reality is that a combination of research, innovation, and advocacy really got us to where we are, and it's touched countless lives. People with disabilities, including intellectual and developmental disabilities, now have opportunities for rich lives and full inclusion in communities where they belong. That said, we're in a tough time right now. I'm certain that you are all hearing things on the news about the costs of services, wanting to cut Medicaid. Fraud in our state is something that's being talked a lot about here in Minnesota, and that is true. There has certainly been fraud. There is fraud in most governmental programs. If you look hard enough, you'll see it. That said, we can't lose sight of where we need to go. If you look at that movement that was kind of scrolling across the screen when the video was playing, you saw how families and people with disabilities themselves have changed the course of history, insisting on their right to make their own decisions and live their own life. And you also got to see some of the social and political forces, some of the fears, our progress, and our compassion. Those things have shaped every step along that historical journey. And it really reminds me and should remind us all that progress isn't ever guaranteed. It's not guaranteed to people with disabilities or their families in this country. And really, values have to guide us when good ideas grow quickly or too quickly, sometimes to scale. And then there becomes some pushback to that. There we go. Just to give you a perspective, in 1967, there were nearly 200,000 people with intellectual disabilities living in large state-run institutions. They were pretty much out of sight and too often forgotten. Families, if they had a child who had an intellectual disability, were often told to drop them off, go home, and give up hope. But people really push back. Minnesota is a state where families really led this initiative to push back and demand for something better than institutional care. They started to build community programs for children, youth, and adults who had no services at the time. They weren't in school. They didn't have the same opportunities as other people. And often these were out of church basements and driven by sheer determination of the parents involved. And it really worked. By 1987, that number had been reduced to a little over 45,000 in the United States, and around that same time in Minnesota, around 2,000 people. And today, roughly only 15,000 people with IDD continue to live in state-run institutions. And in Minnesota, we don't have any state-run institutions specifically for people with intellectual and developmental disabilities. This varies quite a bit by state. There are some states that still have fairly large numbers of people with intellectual disabilities living in institutions, and then many states like Minnesota that don't have any. If you step to that next kind of level and include non-state run programs that have pretty large numbers, 16 or more people living in them, today, that number's a little over 33,000 in the United States, and in Minnesota, about 200 people. But more importantly, today, over 1 million people with intellectual and developmental disabilities receive support to live in their community with their family, in their own homes, or with support from other people. And as I think about this, deinstitutionalization to me is one of the great public policy successes, at least in my lifetime for sure. It shows what's possible when values meet vision and when bipartisan leadership and community action align. But progress, as I said, is never guaranteed. We're now seeing a lot of cracks in that very foundation that made progress possible. While we understand more today, and we know that institutionalization is not just about setting type or the size of a building. To me, institutionalization is mostly about attitude. It's about control, power, and ableism. And we have to ask ourselves, have we built a system that supports full community inclusion for all? And I think for some people, we have built that system, but not for everybody. One of the biggest drivers, I think, in preventing community inclusion is ableism, which is really a system of assigning value to people based on their bodies and minds and societal constructed ideas of what's normal, what it means to be productive, what it means to be desired, intelligence, what that means, excellence and fitness. All those things have meaning to people in our communities. And the norms that are constructed can really negatively affect people with disabilities. And they're deeply rooted in a lot of that history that was scrolling across the screen. That's rooted in eugenics, misogyny, colonialism, and capitalism. People with disabilities are the lowest, the group of people who are most likely to be poor in this country. That has been the case and remains the case, particularly people with intellectual disabilities. And in many ways, the systems that we've created to help them are the very systems that perpetuate their poverty. But we'll talk about some solutions. Another thing that's happening, it's sad to me that we have this resurgence of the word retarded. That is what the word used to be in as a diagnostic category, but for many decades now, that has not been a word that's used. And it's not used to define a group of people because it's very hurtful. It's very harmful to people. And people with intellectual disability, for several decades, have been telling us to stop using the word. But there's been a resurgence of the use of that word. I never thought that I'd be asked to go on public radio and television shows to talk about and have a conversation about why this word is being used more and more. But it is, and it's being modeled to our communities, to youth, to young children, by adults, by leaders in our country, um, by people who are in leadership roles in politics, in television, many, many different ways. But people feel very free to use this word and call other people this name. And if you've ever been side by side with a person with intellectual disability and they're called that name, the R word, then you understand how hurtful and harmful it is to them. And I was once with Nathan, we were at the grocery store, and there was a person bagging groceries in the line next to us. And somebody, I don't even remember what happened, but the customer called the person bagging groceries by the R word. And just watching the body language and the rage that I saw with Nathan, and it wasn't even directed at him, it was directed at another person with intellectual disability. It was really eye-opening to me how damaging that is. And if you think about other groups of marginalized people, there are words we don't say in this country and that leaders don't say. But this is a word that they feel permission to use. And most recently, Joe Rogan on his show used this word, thought it was one of the best things ever that we've been liberated to use this word again. And they see it as kind of a free speech issue, which I believe in free speech. People can say whatever they want. But as a human, do you really want to call people and refer to groups of people with words that are offensive to them and that they're telling you as a group are offensive to them? But that is a big resurgence in our world and in the field of intellectual and developmental disabilities. The disability justice movement is rather new, and it's a disability framework, much like a medical model of disability, which that really was all about let's find cures for disability. Then the disability rights movement and the social model of disability emerged, which really are focused much more on supporting the person with a disability, not trying to cure, but accepting that disability is just a part of humanity and a part of being a person, and accepting and including people. And the disability justice movement has really taken that farther to address not just the disability rights component, but also to understand that within that community, there are lots of differences. And there are people who have intersecting identities of being a woman and a person with intellectual disabilities, or being a person who might not have a house to live in and being a person with a disability. And so it really takes it a step further. And the biggest phrase, the one phrase that if everybody could just remember it and its meaning, is nothing about us without us. For far too long, people without disabilities and lived experience create all the policy, create all the services, make all the decisions. And people with disabilities, including intellectual disabilities, are just saying, no, we should be involved in anything and everything that involves our lives. And that's what we're trying to help with, is trying to make that a reality. Another thing we did as a part of our 40th year celebration was we published a special issue of our news magazine, which is called Impact. And it focused on the 40 big ideas that have moved community living and community inclusion forward across the United States over that 40 years. And we've published this news magazine ever since our inception 40 years ago. It's changed a whole lot, so I encourage you to try to read it. But we looked through this 40 big ideas at some of the systemic ways we separate people with disabilities. Um, and as I started thinking about all these 40 ideas, which I'll show you in a minute, I started to think about ways in which these 40 ideas kind of excluded the community. We're really trying to get people with intellectual and developmental disabilities embraced and engaged in the community, but we've built all these separate systems that remove them from the community. And that's something I think as a country we need to really think about and work on. And we had a couple of studies that really showed me this. One of them was called Putting Faith to Work. And essentially, what we did was go to faith communities. Many different faith communities help people who belong to their communities find jobs if they're displaced or looking for employment. They use their social connections, and some of them even have employment ministries, if you will, specific staff who help people find employment. And in that study, the the what we found, one was when you asked them if people with disabilities in those faith communities were a part of their help in finding employment, and more often than not, they said no, no, there haven't been anybody with disabilities in this employment ministry. And when you probed it a little bit farther, it's because they thought that people with intellectual, developmental, and other disabilities were being served by the service provider, and they would often name a service provider in their community. And with some support, education, and encouragement by the people who were running this study, these church ministry, employment ministries were able to bring people with intellectual disabilities into their efforts, and they had far better outcomes than the disability service providers do. And it was almost flipped. In this country, about 15 to 20% of people with intellectual developmental disabilities have jobs in the community where they're paid real wages, which means 80 to 85% do not. In this study, those numbers were almost flipped, almost identically flipped, where the overwhelming majority of people were helped to find a job and 2 years later had a job. And then a similar thing happened in a study we did around social inclusion. When we would go to disability providers to try to help people with intellectual disabilities get connected socially in their communities, whether that was a knitting circle, a book club, or an aerobics class, or a biking event, it was always really hard because the staffing issues are tough. There's high turnover, there's limited continuity. And so it was always really hard to get big results in those studies. But when we went to those knitting circles and to those card clubs and asked them to try to bring people in, invite people in, the outcomes were quite good, quite and far exceeded what we were expecting from disability providers. That tells me two things. The community will do it. They have to be asked. And secondly, we've built this system that does unintentionally, it is not intentional, but unintentionally continues to segregate people. And we have to ask the community to help. Today, as we're talking this afternoon, or I'm talking at you until the Q&A, but several things are being dismantled that we rely on. Perhaps one of the biggest one are anticipated changes at the U.S. Department of Education that threaten the existence of special education. And many people don't know this, but vocational rehabilitation is inside of the Department of Education. These are critical components for successful transition of people with disabilities into the community. We also know that we have series, I've already mentioned the turnover rates of direct support professionals. That's an area we do a lot of research in here at ICI. And these are the folks that do the day-to-day support to people. But they're leaving the field they always have. They've always left services because they can't live on the wages that they're paid. And then we're starting to see this huge move towards private equity, and the lack of those mom and pop kinds of small services that started in the church basements, and evolved into providers. As those original service providers have aged, and now they no longer are providing services. A lot of times there's mergers and acquisitions and much more of a business focus to service delivery than a human to human type service. So there are a lot of problems. And to me, it's not just about funding. In fact, I think it's more about values, the value issues. And it's about asking ourselves if we really feel that every person, regardless of their disability, deserves a place in our community. And if we still think that inclusion strengthens not only the people we serve, but everybody. And do we believe in disability justice? These are just big questions that we really need to ask ourselves. And I know I believe those things, and the people that work at ICI and in centers like ours across the country, they believe it. But our challenge is getting the community and community members like all of you to believe in the positive benefits of people with intellectual and developmental disabilities being included. And it's not really ideological in my mind, it's pretty practical, because when people with disabilities work, they volunteer, they pay taxes, they share their strengths. Everybody in the community benefits. When their families can rely on stable, skilled support workers, they stay employed, they're healthier, and they're more connected. And when students with disabilities learn alongside their peers without disabilities, we know that their lives are better too. So some things that are happening that worry me too is that too many people with intellectual and developmental disabilities are ending up in places where we promised that they'd never go. So while we don't have institutions, too many are incarcerated in jails. Too many are living in mental health institutions, and mental health professionals are not trained in this country to understand and support people with intellectual and developmental disabilities. In all cases, too many are languishing in acute care hospitals, in emergency departments, particularly people who have very complex behavioral health support needs or who have physical health needs. And so I think often about, we've made a promise, we have legislation, we have litigation that promises the opportunity for people with intellectual and developmental disabilities to have real jobs in the community where they earn real wages, to live in the community, and to have good lives in the community. And yet we only serve about 25% of people with intellectual and developmental disabilities, which means about 75% don't get services by states or by our communities. So if you know somebody with a child who has an intellectual or developmental disability, you'd be more accurate to assume that they're not getting services, especially when they're out of school. And that's problematic because they cost a lot of money. Services cost a lot of money. And so one of the things that I think about a lot is, have we unintentionally created these segregated services that then have a negative impact on or keep people away from and out of their communities? Um, if we really believe in and promote disability justice and social inclusion, then I think it's a mistake for us to always go back to our whatever our legislative bodies are at the state level and ask for more money to do the same thing. Because we know the outcomes need to be better than they are. Um, so we really have to focus on results, and too often these programs are judged by compliance with minimum requirements rather than outcomes. And when I say outcome, I mean things like, did somebody get a job where they're paid a wage? Did they build a friendship? Did they go on a vacation? Do they live more independently? Um, Too often we latch onto a big idea, like all of them that are scrolling on this screen. Um, but there's not always evidence that they work, and they haven't always been evaluated. And too often, like way too often, we've got a great idea, but we abandon what we know from implementation science on how to create effective systems and systems change. So in my mind, we really owe it to anybody who pays taxes, definitely to people who have disabilities and their families, better accountability, not just paperwork, oversight, and more big ideas. We also have to be bold enough to really rethink what we're doing. These services and supports are funded by Medicaid. Medicaid is rooted as a health insurance program developed in the 1960s. And it's not intended to produce the kinds of outcomes that we have based on a social model. So it's really, in my mind, kind of let the community off the hook. I've said that a few times, and kind of resulted in inadvertent segregation. Um, and I ask these questions a lot, like, what are we doing to change the community? What are our expectations of neighbors, of businesses, of faith communities, of the recreation centers in our communities, of artistic programs in our communities, neighborhood centers, community education programs like this? Um, our research shows that the community can produce better outcomes when we ask them to do it. So I really feel like we need to be turning to our community more and asking them to invite people in and to make our communities more inclusive than they are. Because we know the community can do it, and we really have to set expectations for that to happen. But another really critical piece is we simply don't have a workforce that is competent in specifically supporting people with intellectual and developmental disabilities. Universities are not training enough people to meet the demand. For example, the higher prevalence rates in autism in this country. We need a lot more professionals who are trained and able to find children, to do screenings, to do assessments, and more importantly, to create supports that are going to help those children and their families learn, grow, develop, be safe, and be a part of their communities. In addition to that, the staff who provide the everyday stuff, the direct care staff, need adequate wages, they need affordable benefits, and it means the number of people in these positions also need to be culturally competent to meet the needs of the diversity in our communities. And that is not always the case either. We really need people who are speech language hearing professionals, who are psychologists, who are developmental behavioral pediatricians, who are nurses, every single profession that touches the life of a person with intellectual and developmental disabilities from every community within our larger communities need to have that expertise. And we've got a long way to go to make that happen. One thing that I think we can rely on is that disability and this work has typically united people across a lot of different divides, not just the political ones of Republican and Democrat, but also families and professionals, people with and without disabilities. And I think that's because it's so much deeper than politics. It's really about a country that we believe in where a person, regardless of their ability, can live with dignity and purpose and belonging, and that it's a value we have typically as a country shared and embraced. As federal support for programs like ICI, community services, training programs in health and allied health about people with intellectual and developmental disabilities, as those programs are being slashed and the Department of Education dismantled really before our very eyes, it's just really important that we remind policymakers and members of the public that it's really not disability is not a special interest. It's a common good, stronger families, healthier communities, smarter use of public dollars, and the notion that we honor the promise we've made to people in our communities is just so important. And it's never easy. History shows us that, right? We just cannot believe that or be comforted that we've got this all figured out and it's not a problem anymore because it is. We have to continue to work across anything that's dividing us and negatively affects people with intellectual and developmental disabilities. So the 40 big ideas have certainly made a difference and they've helped move us forward. We've trained and benefited from incredible leaders. We push new policy that's really made differences in people's lives and advanced practices that's reshaped what inclusion looks like and what we want as an inclusive community. But our next chapter, the one that we have to do together across this entire country and every community, has to be maybe more courageous, I think. If we really want true community inclusion, we really have to listen more deeply to people with disabilities and their families. They have to be the center of it. And we really have to use our experiences and knowledge not only to show what works, but we have to move people's hearts, because until we move people's hearts, they're not going to open the doors and be inclusive. We have to tell the story of why this matters, not just in data, really, but in the people and the lives behind that data. So when I show you data about institutions, that's one thing to see. It's a whole nother thing to hear from a person who used to live in an institution and now has a vibrant life in the community. That's much more impactful. And the two together are really necessary. And that's really what ICI is about, is bringing our research together with people and to achieve change in human relationships, human to human. And to me, success is built when our neighbors say, you belong here, when employers say, you can work here, when our policymakers say to people with disabilities, we stand with you. That's what we really need. And so that's what our work at ICI is about, and trying to move people to think differently. So when I think about what you can do, one very simple thing you can do is when you hear somebody use the R word, call them out on it. Just say, that word is really hurtful to many, many millions of people in this country. And you wouldn't use similarly offensive word to other categorical groups of human beings. So why? Why do you give yourself permission to use a word that people with intellectual disabilities have said to stop using? It's hurtful, it's harmful, it's degrading. So that's one simple action. Just hold people accountable for that. Another, I think, really important thing is just to understand that people with intellectual and developmental disabilities, they want the same things as you do. So help them have that kind of a life, the kind that you might like. And make no assumption, I said this earlier, that individuals or families that you know who have a disability or a family member with a disability, don't make an assumption that they're getting the support they need and want. They might be getting some support. It may not be what they want or need, and they may not be getting any supports at all because most do not. This one, I think, is the most important action step, and that is really invite people in to wherever you are in the community. If you are a part of a chess club, invite somebody in who might have interest. Or if you are somebody who volunteers at the library, invite somebody in who might have interest in helping you. Make room for people with disabilities in your day-to-day life. We really need that. So I'm going to stop there and open it up for Q&A.
All right. Thank you for that. That was a very good presentation. I learned so much. We have one question so far, so please send in your questions so that we have the expert here that can answer all of them for us. The question is a really good one. Is integration an issue in other countries? Is there an example of a country that does it better?
I don't think that anybody's got it 100% figured out. I think every country struggles with it in their own way. The Scandinavian countries probably have the best reputation for being inclusive and having inclusive systems. A big part of it is it's it's hard to define what inclusion means in a way that every single place in the world agrees with that definition because we all have different words. We define things very, very differently. Nobody's got it fully figured out. There are some cultures, however. So, for example, the Native American culture, they don't have a word really for disability. It is just
Hmm.
part of human development and humanity. It's just a part of who people are. And so in many African nations, that's the same too. Tribal languages don't even have words to define. In Minnesota, that's something that the Somali population struggles with autism. Their children have a very high prevalence rate in our state of autism. It's significant, statistically significantly higher. 1 in 12 Somali
Hmm.
8-year-olds are diagnosed with autism, and there isn't a word in the Somali language for that. So
Hmm.
it's hard that those definitions and those constructs are just hard to agree on internationally. Um, and in many countries, people are hidden away, maybe not in an institution, but I've done quite a lot of work in the country of Zambia, and why their public policy would make you think that kids are included everywhere. When we go out into remote villages, you find a lot of children and adults who are hidden in huts and never come out. And yet there are other communities in that same country where there's a lot of effort. So to get kids in school, it just looks different in across the world.
Hmm. Uh, do other uh, do other societies have institutionalized constructs like we used to? Or I suppose there's one of everything out there somewhere.
Yeah,
Example.
institutions still exist
Yeah.
and um, some of them are quite bad and
Mm,
harmful to people. And
mhm.
there's a resurgence. There is always this undergirth in the United States about increasing the use of institutions and going back to institutions. That is happening right now. There is a lot of effort to cut what's called home and community-based services, which is what really funds people to live in their own homes or live with their family and get some support. And there's a push in every single state in this country right now to cut those expenditures because there's a federal cut, a very large federal cut happened to Medicaid. Medicaid is what funds these services. Home and community-based services are not a core requirement that states must have to be able to offer Medicaid in their states. And so in many states, there's efforts to cut and or in a couple of states to just get rid of home and community-based services. The outcome of that will be people going into much more restrictive environments and a resurgence of uh, populating institutions with larger numbers of people. So there's a huge effort across the country to stop that from happening.
Is that true in Minnesota specifically, or are we seeing a little less of that here?
It's true in Minnesota specifically too. Uh,
Mm,
yeah,
okay.
proposed cuts. This is this was not a budget year, so we'll probably see that more next year, but that bill has not been passed either. So, but it's a challenge. It's a
Mm.
challenge. And Minnesota, frankly, is being targeted by the federal government related to these things because every one of the programs that have been found to have fraud are funded by Medicaid.
Okay, another question. What effect does labeling for a disability help with the individual experiencing it? I think she might mean, uh,
Are there positive aspects of labor?
yeah.
I would say yes, there are. And so the one that is common, the label gets you services and supports, whether that's, educational services or home and community-based services. There has to be a label, diagnostic testing, and a label in order to open up those services. So that's a positive thing. But then for some people, it is a positive thing because they may have gone a long time in their life knowing like something's different and they don't understand what's different. That happened to my brother-in-law, Nathan. He was not diagnosed with autism and intellectual disability until he was about 16 years old. So he'd gone through school, he'd been kicked out of school many, many times, constantly thrown in kind of the behavioral room. And when he finally got a word that described some of the things he'd been experiencing, some of those characteristics, to him, that was helpful. To other people, it might not be. And families take it very differently. For some families, they want to know, and it gives them comfort to finally know this is what's going on with my child. I've understood there to be some delays or some challenges or some differences. But the not knowing is hard. But then for other families, the label is very hard. It's really individualized. I think it's both and.
Mhm. Okay, so we have a good practical question here from probably a parent saying, how do I get my adult autistic children connected with more inclusive groups? They crave more connection, but we have trouble finding places they feel comfortable fitting in.
Yeah, there's a lot of reasons for that. One thing to think about, there's been some studies. In fact, I have a doctoral student right now wrapping up a dissertation on this topic where his topic is really on loneliness. and autism, and uh, how we define loneliness. Like I look at my brother-in-law Nathan, who spends the vast majority of his time alone, but he's not lonely. So he gets social connections a lot online, which there are challenges and things about that, but there are a lot of online play groups for adults with autism, and they find networks there. Gaming is another area where a lot of autistic adults, if you go on the Autistic Self-Advocacy Network, ASAN, you'll get a lot of really good ideas. ASAN. They have a website, and they're very focused on that kind of connection and stuff. So that's a place you can go to get ideas. And then I think you just have to, if you likely know the person, so you know the kinds of things that are interesting to them. Um, I'll use Nathan as an example. When he first started getting home and community-based services, which in our state, there's something called community-directed services, and we self-direct. It just means that he's got an allocation of resource, and we direct his staff. We help him find his staff, select his staff, and get the staff to do what he needs them to do to have a good life. And so we pay an outcome, a retention and outcome bonus to his staff. And we set a goal based on what he likes to do. And early on, like one of his goals, he had this horrific snake, big giant, one of those big python type snakes. And I had an agreement with him, if it ever landed in my part of the house, I was taking the ice chipper after it. But he was very into reptiles. He had this huge, horrible lizard thing once. And anyway, I had no interest. My husband had no interest in getting him connected to a herpetology club, but I knew these things existed because they marched around the Renaissance Festival, sometimes with those lizards on like dog leashes. So I knew they had to exist somewhere in our state. And so we we helped him with his staff to find one of those communities where because of his mutual interest, he would find a mutual get connected. And he did, and he found people who would for lack of better words, like house it for his creatures. Or if we were going somewhere, he could take his snake to somebody else's house and they'd care for it, make sure it was okay. Those kinds of connections. So it's really one small interest, a mutual interest, then going and trying to find people and places where that can be explored together.
Mhm. Okay, thank you for that. That's a good idea. Another listener says, what ideas can you suggest for including disabled people who struggle with controlling behavior? My adult child with intellectual disabilities will consume all food in sight and can act out in an injurious nature. Therefore, it can be very challenging for others to consider including us.
Yeah. That's a very common challenge that people face. So one component of that is making sure that you have access to somebody who can use positive behavioral supports to help mediate some of the behavioral challenges and take one small step at a time. When you identify a place you want to go to, um, and work with that behaviorist to help. They're not all behavioral professionals don't think the same and don't use the same approaches. So really looking for somebody who uses positive behavior supports, I think is one critical step. Um, and then not expecting somebody, your child, to be able to go and stay the whole time. Like, think about minutes. Start with minutes, very small steps. And are there events that you can go to that don't involve food? What are events that could happen, could be mutually interest, based on mutual interest that might not have food. So trying to figure out how can you adjust the environment to prevent that behavior from happening. It's very hard. And you got to find the right behavior support specialist, which is we just need so much more training. In Minnesota, we are not producing near enough people with these specialization skills coming out of higher ed to meet the community demand, and that is true across everywhere.
Sorry, is that position something that has a certification or a degree, or how are those people trained?
Yeah, so it's fairly controversial right now. There is a credential called a BCBA, um, and that is required in some states, but not all states. There, at the root of most behavioral shaping interventions is something called behavior analysis. And there's a controversy right now in the field. It's been going on for a long time about a program, an intervention called ABA, Applied Behavioral Analysis. I view it as a big umbrella term that focuses on shaping behavior, but there are really vastly different approaches and models. And so some of them are very intense, discrete trials, families having to have their child 40 hours a week, just very, very intense. And then there are others. So there isn't a standard credential that everybody agrees on, but most of those professionals have degrees in some form of educational psychology, psychology, with emphasis on behavioral supports.
Hmm. All right. Do you have any information on the incidence of alcoholism and drug addiction among persons with intellectual disabilities and recovery resources focused on serving their needs?
Yeah, we've been through this as a family, so understand the need. There are some programs. We were so fortunate in Minnesota to live in Minnesota, to live in the Twin Cities area in Minneapolis. There's a program called Vinland here that focuses on addiction and people with autism and or intellectual developmental disabilities. Um, and there's an increasing body of literature around this topic. I don't have the statistics off the top of my head, but if you sent me an email, I could look them up for you and get them to you.
Hmm. All right.
Just forgotten about, in the
Yeah.
and really this thought that and it is true, like the common Nathan went through outpatient treatment, I think 4 times. He's now about 12 years sober, but it took him a long time and many trials to finally figure it out. AA simply did not work for him at all, because he never had a sponsor that really stuck with him because they didn't understand him. So it would last a little bit, but there's also really kind of abstract thinking around the 12-step model. So um, he didn't use that very much, but the repeat of outpatient treatment did finally work for him.
Okay. So I'm taking a deep breath because this is probably a huge question. What kind of effects are you seeing from the cuts in special ed?
Yeah, it's a little bit too early to know what that's going to look like. That's the thing. There's all this looming stuff, and we know what's going to happen if it gets authorized and gets carried out. So there's not a lot of data right now to tell us what will happen. A lot of speculation in terms of it, but not a lot of outcome.
Okay. You spoke a little bit during your presentation about employment opportunities. And one of our listeners is wondering, uh, how have those opportunities increased? And I also would like to know if you could address the pay issue. It seems that there's been talk about requiring a minimum wage, and I'm just not remembering whether that's something that
Yeah,
has.
a very real issue. So most people don't understand that there is something called a 14C certificate, and that basically allows an employer to pay sub-minimal wages to a person who has an intellectual developmental disability. This is in federal law and in many state statutes across the country. We have a big effort in Minnesota, not necessarily to get rid of 14C, but to use the problem of that, of sub-minimum wage, to be a driver to help everybody who wants a job and has an intellectual disability to get a job. Like, let's focus on that. Most people want to work and they want to earn money so they can do the things that they want to do. And yet we continue to have this system that allows people to be paid less than minimum wage. So think about that. Minimum wage in this country is $7.25 an hour, I believe, still. So where can you live on $7.25 an hour? And sub-minimal wage for some of these folks are making like less than $1 an hour, and they're spending their whole week doing stuff. So if they want a job, let's help them find a job. We know how to do it. We know how to carve jobs to meet employer need and also offer people a job. We just have to have the will to do it. And I think a big part of that will is employers stepping up and beginning to shape and realize, hey, when we employ a person with intellectual and developmental disabilities, there are a lot of benefits to our company or to our program or whatever type of employer it is. There's a lot of research that documents that it's not just about the person having a job and getting a paycheck, which is really important. It's also about how it shapes the whole culture of the organization when a person with intellectual developmental disabilities works there.
Hmm.
There's mutual benefits.
Well, I have one of our listeners has a very brief story that is a positive story, so I'll share that quickly. She says that her sister's autistic grandson was mainstreamed in public schools until his adolescence, when his behavior was described as inappropriate, and the school recommended transfer to a school designated for autistic children. Once he was there on his first day, he said, "Finally, I have some friends." He's been happier there than in any other school experience, and not what anyone thought would be best for him, but he
Yeah,
found his people were. Mhm.
I do think it is one child at a time, right? And I work in a place that really promotes employment, promotes inclusion, and we believe that, and we work hard for that for people who want it. And yet, right at the beginning of COVID, Nathan lost his job, and he hasn't worked since, and he's been the happiest I've ever known him to be. And I think a part of that is some of the social pressures that were on him, mainly just like getting to and from work and what he would see and experience from other people in the community that would stress him out. And then he'd go to work after that stress. Um, So I think it is one person at a time and individualized supports. And I know many, many, many families who choose non-inclusive programs for their children in school. And in my mind, as long as the child's learning and as long as the child's happy and are making progress, then we shouldn't say you can't have that. On the other hand, lots of kids go into segregated programs and they just stagnate and they're not learning and they're not developing relationships and building new skills. And so when that happens, we need to push for what people want and what people need.
Mhm. All right, so another one of our listeners says, just has identified yet another issue for us in case we don't have enough on our table at the moment. How do you invite someone in when these issues often are still kept private from your community? I'm not sure. I think he means perhaps that someone with a disability is kept private in the community and people may not know that individual. Um, so in addition to the money problems and the training problems that you are fighting, we have the issue of perhaps the stigma
Mhm.
of this as well.
Right. I think stigma is a big piece of it, stigma and ableism.
Mm-hmm.
Some of that is just trying to break it down. When you see a person with a disability, starting to try to communicate with them in whatever way they communicate. Or if this is a story from the country of Zambia, but I will never forget it. It shaped me so much in how I thought about these issues. The first time I ever went over there, faith communities are just hugely important in that country. And people like line up for hours to get into a faith service. And we were working in this one parish, and I noticed that there were no children, no adults really with disabilities in all those long lines and the people inside. And so I asked the priest, where are the children with disabilities? And he's like, we don't have any. And I'm like, oh, yeah, you do. There can't be this many hundred people here. And so working with him over time in his homily, and I have no idea what he said because he was talking in their native language. He invited families to come to the parish if they had children with disabilities. The very next day, over 200 families showed up.
Oh my goodness.
He was floored. I mean, because here he had told me they had no children, and then a lot of great things happened. So making sure that people understand that you welcome and you are interested in them or in their children, and just trying to get those inroads and get to know the person and their family and invite them in, I think is the best strategy.
Mhm.
One person at a time.
That's quite a story. All right. Someone says their son has a nonverbal learning disability that was diagnosed in college, but it's not in the diagnostic books. And this person says they hear that there may be a name change for the disability. And are you aware of efforts to rename disabilities in
That happens all the time. And it just depends on when some of those diagnostic manuals, the Diagnostic and Statistical Manual is one big area, and then another way that happens is what are called ICD-9 codes that are used in healthcare. So those are periodically reviewed and they periodically do get changed. When the autism diagnosis got changed to autism spectrum disorder, it really, really changed practice, eligibility, all kinds of things. Also caused a lot of challenges, but it happens. Intellectual disability, there was an effort, I don't know, less than a decade ago to make some changes there to the ICD-9 codes that were inconsistent with the American Association on Intellectual and Developmental Disabilities at a time that I was the board president there. That was just a really interesting process because it's this convergence of the American Psychological Association and the folks who run the ICD-9 stuff and trying to get them all to talk and agree is an interesting process, but it is very common. They do get reviewed and modified periodically. Not all of them all at the same time, but there's a process that the professional associations go through to make those changes. And I'm not aware of what's happening with that specific nonverbal diagnosis.
All right, thank you. Um, how are the needs of LGBTQ plus persons with intellectual disabilities being recognized and addressed in research and services?
It's increasingly being attended to. It's interesting and hard though, because one, intellectual and developmental disabilities, that whole population of people are almost always just excluded from all research, unless the research is specifically about that target group.
Mm.
And then getting permission to do the research is difficult to get through universities because of assumptions about this population. So it's something that the research staff at our institute, we fight it all the time with our own institutional review boards. But there's a much greater, that disability justice movement. It's really helped to open those doors to not just look at autism. Okay, we're going to define this person by their autism. No, this person has many, many intersecting identities in terms of their cultural background, if they're GLBTQ, plus they have this disability, and that all works together to create who they are as a human. And so there's an increasing body of research out there, particularly in autism too. Um, there's a lot of autistic researchers driving that research too.
How about research being done on aging developmental disabilities? I don't know whether this is applying to seniors with developmental disabilities. I think maybe. Are they in any way a unique population that needs different interventions or services?
I'll answer that two ways. One, it's a great problem to have, right? Because the life expectancy now of people with intellectual and developmental disabilities mirrors the United States population. So it's just inched closer and closer and closer to that because of medical advances. So that's very positive. However, it's a relatively new thing to think about this group of people. Well, most people don't work until they're 75 years old. So why are we expecting people with IDD to continue to work until they're 75 because they got to go over here to this day program or to whatever? If they want to work, great. If they have to work because that's how the system is set up or their program is set up, that's a different story. And so there, you're starting to see many providers offering what are called retirement services. We have a researcher here at our institute that looks at retirement and people with intellectual disability and partners with a long-term partner of ours in the country of Australia, looking at inclusive retirement. And so thinking about what other retirees do, what do they do during the day? And trying to connect and plan in advance for somebody to have a purposeful retirement. I know here at the university, there's coaching and counseling for people who are thinking about retiring and how to have a purposeful, planful retirement. And so trying to figure out the opportunities that work for people with IDD to think about that as well, but also about end of life. And really understanding death and being involved in planning what
Mhm.
they want, how they want to live the end of their life, and teaching really this is more a family. I can't tell you how many families I know that try to hide death from people with IDD. I know families who the mom has died and the dad and sister don't want to never share with the brother that their mom his mom just died,
Mm,
that and think because he has significant cognitive limitations that he doesn't understand. But he knows his mom's not there,
mhm,
probably wondering why. So
mhm,
really trying to think about that and plan for that and address advanced directives and things like that. A lot of times our systems just make assumptions that people with intellectual disabilities have no opinions about that. And I can tell you, my brother-in-law has very strong opinions about it if he's asked and if he's given the respect to have some input into it. So there is
mhm.
an increasing body of research around it, and we're learning uh, ways to explain, ways to support. There's all kinds of tools and resources out there.
Just sort of tangentially, I would assume that there's a large group of people moving as they age from what has been for them a fairly stable situation for decades, in case their families are caring for them, to a point where their families, as you were saying, have passed away. Their siblings have moved away. There's no one for them to be with anymore that understands them and has known their needs for the last 40 or 50 years. And suddenly they are kind of adrift and having to find new housing situations. And I can't imagine the upheaval in their lives.
Yeah. And that, yes, that's a big problem. It's a way in which too many people enter the system. Um, and by the system, I mean formal supports and services.
Hmm.
And there's a lot of reasons that that happens. Sometimes it's just somebody's doing fine and living with their parents and working here or there, and everything's going well until, as you said, one of the parents dies, and then shortly thereafter, another parent dies.
Hmm.
And that's why it's so important to make sure that all kids and adults are at least known by the public system that provides services. Because if you wait until that situation, then you're not even known. You're starting from the very beginning. You're on no wait list, nothing. You usually in that situation, some sort of temporary thing would be some sort of temporary crisis service would be set up, and then you'd be working toward a more permanent situation. But the biggest way to prevent all that is to start very young, talking to families about planning for the future. That's coming out of my mouth. At the same time, we do not have this all figured out for our own family member, Nathan. It's very hard. It's we don't know where our kids are going to land in their adulthood. Um, he's got his own apartment in our house. So there's a thought that we could have somebody live in our part of the house when we're gone. It we know it needs to be figured out. I actually did when after the fire, it sort of catapulted me to make the call. I made the call with tears running down my cheek, but I made it. I forced myself to call a provider and say, "Can we go out and have coffee and start planning this?"
Hmm.
And it's hard. It's very, for me especially, I know way too much about the system, so I'm always a little bit um, scared of it, but there's really not another option. So I better start planning for it now and making sure that we've at least done everything we can to make sure Nathan doesn't end up in an institution, which is my big fear.
Hmm.
And so there's a big push now. There's something called Charting the Life course. It was one of those 40 big ideas, and it's one that's got a lot of traction and is really starting at the very, second a child's diagnosed, that's a very stressful time for families, but introducing very early on and then using this same framework throughout the life to help families plan and start thinking about those hard things about money and able accounts and all these overwhelming things early so that when that time comes, they're better equipped.
So I think a good spot to end our discussion today is you've mentioned many things that we can do to help improve attitudes and understanding of this community. And are these things available to review on your website? Is there something else that's important that we know about to find some of these things?
Yeah, you can go to our website and find a whole lot of the things that I've talked about. Certainly all our research and stuff is on there. Another good resource in because this is a national resource is something called the Association of University Centers on Disability, AUCD. It's the network of centers like ours across the country. So it basically, is a national lens on research that's going on in this space. It's
Hmm.
good to go to.
Okay. Um, And does your institute have a specific website that we should know about, or we can just Google?
No, if you, it's ici.umn.edu
Okay,
and AUCD is just aucd.org.
all right. Well, fantastic. I thank you so much. This has really been an eye opener. I've known nothing about this particular community of individuals and the efforts being made on their behalf. And so thank you very much for speaking about not only that, but also your own personal family situation, which I think really adds to the story. Um, so thank you again for coming and talking with us. Thank you, as always, to the audience and your questions. Thank you to Ollie. And thank you to our sponsor, the University of Minnesota Alumni Association. Please join us next week. It's our last session in this series in 2026. Our session next week is titled Encore Adulthood, Opportunities and Challenges with Dr. Phyllis Mohn, who is a professor emeritus in the Department of Sociology at the University of Minnesota. So we will see you then. Thank you. Have a great day. Bye-bye.
Everyone, bye.